So, we've got three symptoms here. Herpetic gingivostomatitis, cytomegalovirus, esophagitis, and intertrigo.
I think it could be.
Well, Dr. Hawks, herpetic gingivostomatitis can certainly cause blistering in the mouth and throat.
I'd agree with that, Leslie. Cytomegalovirus esophagitis could also contribute to an esophageal problem. But what about intertrigo?
Intertrigo is usually a skin condition characterized by moist patches of redness or rash in the folds and creases of the body.
Interesting theories, everyone. But I believe we're dealing with ichthyosis bullosa of Siemens here. And no matter what you guys think, the patient needs an auriculectomy, risky though it is.
All right, guess we're going to go in and do an auriculectomy. No point in arguing since you're going to insist anyway.
Damn it, Tracy. Can you not be a crippling pain in my ass for one day?
I've asked the same of you for years. Just like your next spiel.
I've been a doctor for years now and I know what I'm doing. Why would you even question my decision to perform an auriculectomy on this patient?
I have serious doubts about the diagnosis, Hawks. It doesn't sound related to the symptoms you described for ichthyosis bullosa, nor does the surgery for your diagnosis.
Your doubts are a you problem. I'm telling you the truth. There is no other explanation for his condition than ichthyosis bullosa of Siemens.
I understand that, but let's be cautious this time around.
Holy damn. I'm sorry to hear that the patient is in critical condition.
Yes, I can see that. It's a shame we had to perform an auriculectomy on them when they actually have ichthyosis bullosa of Siemens.
I know it was Dr. Hawks who insisted on performing the surgery.
Yeah, but he didn't consult us first about the potential complications. I'm starting to think our hospital needs a change in leadership.
Everyone has been saying this for like a year now. I'm really beginning to regret coming to work here. Right now, we should focus on finding the correct treatment for this patient. What are your thoughts?
Well, it's not every day we're faced with a case like this. But considering the unique nature of their disease, maybe we could explore more experimental treatments.
Experimental? Are you sure that's wise when they're already in critical condition?
I know it sounds risky, but sometimes we have to take risks to save lives. We just need to ensure it's the right one.
And I thought Hawks' suggestion was stupid enough.
What the hell were you thinking? Ichthyosis bullosa of Siemens and auriculectomy. I should have known better than to trust you fools. What am I paying you for, huh?
Dr. Hawks,
Kiss off, Leslie. Don't try to defend yourselves. You didn't even bother to diagnose the patient properly. You nearly killed him?
But Doc...
Shut up, Randall. I don't want to hear your excuses. What are his symptoms, huh? His fucking diagnosis.
Herpetic gingivostomatitis, cytomegalovirus esophagitis, and intertrigo, and your dumbass diagnosed him with ichthyosis bullosa of Siemens.
Well, we thought it was an unusual case of eczema.
Eczema. You thought a kid had fucking eczema and needed an auriculectomy. You're all lucky I don't fire you on the spot.
that would be the best news if you weren't bluffing.
So, how's it going in oncology? Any breakthroughs lately?
Actually, yeah. We've been making some progress with the new drug trials we've been running.
That sounds promising. I must admit, though, sometimes these complex cases can leave you stumped.
You're telling me, sometimes they really challenge your skills and patience.
Well, just today, something has clicked for me with one of my patients. I'm pretty sure I know what's going on now.
That's great to hear. Wait, you don't want to hear about the latest in politics?
Hawks leaves faster than Johnson can finish his sentence. I know you all are upset about my lack of medical attire, but I assure you, the solution I have found for saprophonosis will change our approach to ichthyosis bullosa.
And what is this new diagnosis, Hawks?
You're not actually serious, are you? Ichthyosis bullosa was the correct diagnosis.
Yes, we've been treating patients based on that assumption for years.
I understand your skepticism, but trust me, I found a key detail while enjoying my lunch with Dr. Johnson, which led to the revelation of saprophonosis.
And what exactly is the prognosis for this saprophonosis?
It's quite grim, unfortunately. The affected individuals have limited life expectancy due to multiple organ failure.
That's really bad news for anyone on the transplant lists around here.
No, that news was already bad because of qualified surgeons, quote-unquote, like yourself. I was just saying that if I had less idiotic doctors to work with, then the ordeal with the wrong diagnosis wouldn't have happened.
And you are admitting that you were incorrect about ichthyosis bullosa of Siemens?
Exactly. It was actually saprophonosis all along.
Good job, Hawks. You found the right diagnosis for the patient. But how do your less idiotic doctors factor into this?
They didn't declare saprophonosis like they should have from the very start.
Would your day have gone any better had the right call been made from the start? You wouldn't be in here wasting your time when you could be home, jacking it to the latest Only Docs video you have saved on your phone.
That's rather personal, Tracy. There's no way you don't have hentai stashed in your otherwise empty filing cabinets.